earlier, I spoke with Yevgeniy, Feyman, senior fellow at the Manhattan Institute in New York. Delays, technical glitches, and political opposition. All aside, Feyman says the Affordable Health Care Act still has a long ways to go before it can accomplish its goals.
So the Affordable Care Act, or Obamacare as it's more commonly known, creates 51 exchanges, which are insurance marketplaces around the country. You have one in every single state, plus DC. So starting today, people are supposed to be able to buy health insurance coverage on these exchanges, and the coverage is supposed to start on January 1st.
Walk us through the problems that have occurred and which ones are serious enough to focus on when it comes to the technical glitches of the program itself.
Sure. So it seems like the biggest problem is actually with this quote-unquote data hub that the federal government is putting together. This data hub is supposed to link from the exchanges to all the other federal agencies like the Social Security Administration, Department of Homeland Security, the IRS, and it's supposed to double check that what you're saying is in fact true based on all of your inputs. So it'll check your income against tax records, it'll check your citizenship status, it'll check if you're on any most wanted lists, all sorts of things.
I mean, now, let me ask
you
this.
The big problem with this data hub is that it's largely been untested. It was supposed to have months and months of testing. A lot of it was delayed, and the final test that was supposed to last a few weeks was done in about 7 or 9 days. So there's a major security and privacy concern there. Other issues with the law have been the delay of the employer mandate. So employers are now required to provide health insurance coverage to their workers if they have 50 or more full-time employees. That requirement's been delayed, and a few other more minor requirements like out-of-pocket limits for large group plans that these employers provide have also been delayed until next year.
Of the Americans that are currently uninsured, they're now going to be required to basically opt into the system for the most part, and if they don't get health insurance, they can be penalized up to $95 or so per person by not opting in. And what some critics are saying is that if you're forcing people to join in this insurance and not enough actually opt in or join, then that's a problem for the ones who have joined, because you're sort of sharing the cost over a very broad group of individuals.
So what happens if these young people choose not to enter the risk pools, instead they choose to pay the penalty, which is either $95 or 1% of your income in the first year, whichever is greater? Then what's going to happen is the only people who enroll are going to be older, sicker people. Those people are going to face ever higher rates, and then come year 2, the rates are going to skyrocket even further.
You need a lot of healthy, uninsured individuals to jump into the plan for this to succeed. So I guess the big question in the room is, do you think this plan of Obamacare or the ACA will succeed?
Not in the first year. The thing we're seeing is that for many young people, it's not going to be worth it to purchase these plans, and paying the penalty is a very good and cheap alternative.
Okay, now just quickly I want to talk about politics here, this issue with the Republicans and the Democrats and their goal of trying to delay Obamacare. I suppose that if people are already enrolling in the program, you can't roll it back now. It takes effect on January 1st. But here's my question. If the Republicans really think that this program is going to be this awful and terrible, why not just let it happen as it is and see what happens? Because if it doesn't work out, then it doesn't work out. If it does work out, it does work. I mean, it doesn't make any sense to try to stop something that's already taken off now.
Sure, and a big part of it is the campaign promises that a lot of senators and representatives have made to their constituents. One thing that a lot of Republicans, I think, are concerned about is if this program succeeds in the way that it's supposed to succeed, we're not actually going to reduce healthcare costs. So more people are going to be insured. That doesn't necessarily mean that more people are going to have access to healthcare. And on top of that, this program doesn't address the fundamental, very high cost that we face in our health insurance system. Politics aside, I think that's the base concern. But there's also an issue of just trying to make good on your campaign promises.